So one of them says methylation defect, and the other one says mitochondrial defect.
Chondrial.
So please
Yes.
excuse me if I've said it wrong. But I mean, what are these? I felt it strange. I didn't see these anywhere. Can you give us some information about these, doctors?
Yes. So these are actually, these happen at the cellular level. At the, like, outer level, we see the blood sugars are increased, and now we do work on the blood sugars. We try to remove it superficially or suppress it superficially, but again it comes back. Okay. So where this actually concept came from the functional analysis. So this is a part of the functional medicine. So, and finding the root cause. So these two major defects were found in all the like metabolic disorders, including the hypertension, dyslipidemia, obesity, so and diabetes, pre-diabetes. Everywhere these two defects are found. And what is methylation? Especially inside the cell, the metabolism to happen, the substrates need to be methylated. And that's how, like, we put petrol or diesel inside the vehicles, like that methylated substitutes should be there for the metabolism to process properly. But because of the lack of methylation, there are two factors: either we have like less of the methyl donors in our food, or secondly, in many cases we also find there is a defect in the gene that is called as MTHFR gene. That is the gene responsible for the methylation, and there is a defect. So these are the two important factors leading to the methylation defect. And who are the methyl donors? Especially every diabetic patient, they more or less take the methyl cobalamin without knowing and this is particularly used for neuropathy, diabetic neuropathy. And but if you take more, then there will be imbalance, and again, despite having more methylcobalamin, it doesn't help. And another is like folic acid, or better to say L methylfolate. And other ones are thiamine, pyridoxine, niacin, other B complex vitamins. Basically, they are the methyl donors. So, in the two factors, lack of methylation is because of lack of methyl donors, and the defect in the methylation gene or the MTHFR gene. Okay. Now, moving to the second option, that is the mitochondrial defect. So how do we know that? From that only, because why people are having lack of energy, easy fatigue, and shortness of breath. And even if you go to hypertension also, and also cardiovascular disorders also. And mitochondria, let me tell you, from the developmental history, actually we have studied in our 9th or 10th class that every cell has got one mitochondria. And the role of mitochondria, again during the COVID, you must have heard about this mitochondria, because it helps in RNA and DNA replication. So COVID virus was able to replicate. And from the developmental history, we know that actually mitochondria was a bacteria that got access into the cell, and it was living there inside it with a synergy, and helping our cell grow. And that is how, and we know that this is actually the powerhouse of the cell, because it also produces the ATP, the adenosine triphosphate, that is the energy currency inside the body. So if the mitochondria is at defect, then you will have lack of energy, and the metabolism also will get halted, and many functions in the body will not get done. And if I talk about how many mitochondria are there in specialized cells like the skeletal muscles, you will be astonished to know that per one cell of the skeletal muscle, there are 1 to 2,000 mitochondria. And that is how it is very important, again in the muscle metabolism, again in the insulin sensitivity. Then second one, more important organ, that is the liver. So one hepatocyte, it contains 4 to 5,000 mitochondria per cell, and that is how it is more important that for the functioning of the liver, it is very very important. And then again, the very important organ which starts beating in at 16 weeks inside the mother's womb, and it beats till you live, that is the heart. So one cardiac myocyte, it contains 9 to 10,000 mitochondria per cell. So that is the important reason why the heart failure patients or the coronary artery defect patients or the blockage patients, stroke patients, heart attack patients, they feel low in energy, they feel shortness of breath. So while what treatment we do, we give medicines to slow down the heart. We work against the heart. But I tell you, because that is from my experience, if we improve the mitochondrial health, the patient is again back to full of energy, normal functioning, and I have seen the ejection fraction in the echo to improve from 15 to 35%, even less than 15 days. That is the miracle of the treating the root cause, and that is the same holds true for diabetes too and all metabolic disorders per se.
Wow, interesting, Dr. Jagadish. We have spoken about mitochondrial as well as methylation defects. How is it not only going to affect diabetes but also heart strokes and heart diseases? I think this is an eye-opening, especially for me, and I'm sure it is for all our audience as well, Dr. Jagadish. And the time that you have given in terms of improving and ensuring that mitochondrial levels goes up within 15 days is great. I think probably I